Hi, I'm Scott Ingram, specialist plastic surgeon. I'd like to talk to you about nipple reduction procedures. I do a lot of breast enhancement surgery, most notably breast augmentation. An area of the breast which is frequently overlooked as an area that we can improve on is the nipple. Now, nipples vary in size and shape, and as a result of pregnancy and lactation, breastfeeding, the nipple can actually elongate and enlarge in size, and it's an area that we can improve on to enhance the overall effect following a breast augmentation procedure. So here we have an ideal candidate for a nipple reduction procedure. She's young, fit and healthy. She's in her early 40s. She's had a pregnancy and has a breastfed. And as a result, she's got elongation of both nipples. Now, what we see here is the typical sort of thing that happens in this situation. That is, that the length of the nipple is now longer than its width. So the length-to-width ratio is greater than 1. Normally it would be less than 1, so the nipple should be a little shorter than it is wide. Now, in this case, all we're going to do is actually reduce the length of the nipple because the overall width of it is, in fact, fairly normal. But occasionally we do get width increases as well, and there are other procedures we can do which will reduce the actual diameter of the nipple too. So what I'm planning to do here is just to remove a very, very superficial layer of nipple and areola skin at the base of the nipple itself and just set the nipple back into the breast. That's, as I said, very superficial, so there's no effect on the nerves or the ducts underneath the nipple itself. So we maintain sensation, we maintain erectile function, which is important to some people, and we also maintain the ability to breastfeed should that be necessary as well. So it's a fairly well tolerated procedure. It could actually be done in a local anaesthetic if need be, but in this case we're going to do it at the same time as a breast augmentation procedure. Now, as I said, this can be done as a standalone procedure, but is often done in conjunction with breast augmentation. Interestingly, if you don't do this kind of procedure in conjunction with a breast augmentation, what can happen is the nipple itself tends to fold over after the breast has been augmented, and particularly when the breast is now pushed into a bra, you'll find that there'll be a little indent underneath the nipple in those cases. So, as I said, this is a procedure which really can enhance the outcome after a nice breast augmentation procedure, and it is something which I discuss with any patient who has an elongated nipple, as in this case, and something which I would recommend is done in most cases. As I say, it's something which we find really adds that last little touch to a breast enhancement procedure.